Hey guys, welcome back. It's been a minute. If you're new here, I'm Jenna Stewart. I am a health and lifestyle coach and somatic practitioner, and I focus on unlocking trauma through myofascial release and chronic pain management. If you like what you see and you want more tips on how to manage your chronic pain or just live a better life, subscribe, give me some feedback. What do you want to see more of? Post your comments. I love the feedback and I love interacting with you guys. So let me know what you think. Today, I want to do a 15 to 20 minute, no excuses sequence that can help release tension in your back, neck, shoulders, and glutes. So let's get started. As you can see, I am in a cast. I've been in it for 4 weeks now. I will say that the myofascial release technique has helped me tremendously with just shoulder, neck pain. My hips are kind of out of whack because I'm on crutches. I've got calluses on my hands. So this for your hands, if you're on crutches, definitely need to use the spiky neuro ball. The first thing I'm going to start with is the spinal alignment, and there is a full video to do the full sequence, but this will be just a portion of this video today. So what you're going to do is you're going to put your sits bones right at the edge of the roller and then gently guide yourself back, so head to tail, and you can adjust once you're there. Hands on the ground, and the goal here is to feel the roller in every point of your back. So the only place you won't feel it is the nape of your neck. So back of the head, and then from the upper shoulder all the way down to the tailbone. And you just want to sit here, take a couple deep breaths, feeling your back connected with the roller. Great, taking a deep breath here, you're going to stretch your hands out, spidey hands. You'll feel the stretch in your forearms, and then you're just going to alternating flex. This is stretching the fascia out, allowing hydration to get in, working those blocks out. Good. Relaxing the shoulders, let those drop around the roller, the rib cage, the hips. Now you're going to take your hands out again, and I want you to pick one leg up, finding your balance, and then you're going to start to alternate. I like to do about 30 reps right here, keeping the core tight, rib cage closed. This is a balance exercise as well. Great core workout. Loving the drilling above. Always, without fail. I come out here to shoot a video and they're doing construction above my house. Good. Both legs up. Find your balance. And then both feet back on the floor. Take a minute here, deep breath, relax everything. Now we're going to do an arm sequence. So you're going to shoot your hands. This is goalpost arms, just allowing the arms to open up the chest. The weight of the arms dropping, keeping the spine connected to the roller. You're just going to do small circles. Breathing, keeping the spine connected to the roller. And reverse. Two more. Good. Now take your goalpost arms, just stretch them as far back. The idea is you want to be able to just drop them onto the ground, opening up the chest. Awesome. Now when you get off the roller, again, straighten one leg, and then you're going to roll towards that straightened leg. So you're just going to kind of ooze your way off. And then slide the roller out, straighten your leg, and just allow your body to reset there for a second. A couple deep belly breaths. Good. And always getting up from this position, roll to your side and push yourself up. Next exercise, you're going to slide the roller underneath your legs and you're going to lay back down. You're going to push your hips up, again putting this right on your sits bones. So women, right where the top of your G-string would be. And I just want you to pick your legs up into your chest. You can hold on to the roller, make sure it's stable. Again, you want to do this on carpet or a yoga mat. So this, if you do it on hardwood floor, this will slip out. So make sure that you're taking precautions for safety. So you're just going to put your knees into your chest, just decompressing the back here. Take a couple deep breaths. Good. I want you to put one of your feet on the floor. Grab your knee on the opposing leg. You are going to feel a tremendous fascia stretch right here. It's one of the best quad stretches you can get, especially if you're sitting all day. This is amazing because you're stretching out that hip flexor, which if you're sitting is contracted. So again, squeezing in the midline. So if you imagine this line going down the center, you want to pull your knees in together. So you're shrinking that space between your legs. And as you're pulling in, you're pulling the leg down. If you want more of a stretch, you can take this leg, slide it in closer, and breathing. Keeping the rib cage closed. You don't want to arch. Keep that shoulders melting into the mat. Rib cage is dropped, closed, abs are tight. Now you can take that right leg or whichever leg is on the ground, just extend that out, pulling the knee in tighter. You're gonna feel full body stretch, side body, hip flexor, quad, all the way down to your toe, like trying to touch the wall at the opposite end. And then bring both knees in and repeat on the opposite side, pulling that knee in, closing that midline. Rib cage is closed, shoulders are dropped. Pull it in a little closer for a maximum stretch. Oh my goodness. And then straighten that leg out. Touch the wall on the other side. Good, both knees in. And if you want, you can hold the roller and just massage that lower back and the upper glute. Oh, it feels so good. And just stay here. Little back and forth rocking motion on either side. It's really hard to target that upper glute area, so this is a good exercise if your glutes are really tight, or if you have lower back, because if these are tight, your lower back is tight. Good. And then you're going to push that out from under you. And again, just put your feet on the floor. Just allow a reset here. And let's move on to the next exercise. So next we're going to do the upper back. So you're going to lay back onto the roller, opening your arms out, stretching your arms out, and you'll find alignment because you want your arms to be exactly along the roller, okay? So what we're gonna do is we're gonna shift to one side, pulling this arm in. You may have to adjust a little. This one goes behind your head. This one goes just tucked in, and you're gonna give a nice roll onto your shoulders. You kind of have to push down into the roller to really get that fascia moving. Again, you don't have to spend a lot of time here. You can just give it a quick roll. There is a spot in the armpit, as I've mentioned before in the other video. If you just find that spot and just lay on that for a second. A lot of tension is stored in there, especially for women. And then you're gonna roll to the other side and repeat. And since hopefully you're following along, we're gonna go through the full sequence. So other side, stretch that arm out, then you can tuck it behind your head, This hand grabs onto the bicep with the opposing arm. And enjoying the sounds of construction. And then opening that up, finding that spot in the armpit, relaxing there. Take a couple deep breaths. Kind of move around a little bit. You'll find it. Good. And then we're going to do an upper back roll out. So this one you have to drop down to the top of your shoulders. You're going to take your arms, put them behind your head. You're going to push your hips up to a bridge. You are going to close your elbows together and you're going to slowly roll. You may have to walk your feet in, curving the back. Stop when you feel it. Allow the weight of your back to just sink into the roller. Oh, good. And just moving all the way down to your mid back. And then drop your weight. Adjust back to your starting point, top of the shoulders. Adjust your feet. Press your hips up. Close the elbows. I like to sit right here at this spot because it really gets into the neck, shoulder, upper back tension. And a lot of times my back will crack on its own, which is resetting those vertebrae. Oh, that spot right there. Wow. And then as you start to move, be sure to tuck your chin to your chest and roll up. Good. Again, if you want to stop and do that multiple times, I highly encourage that. And last, we're just going to do some really good, juicy glute release. So, sitting on your roller, supporting arm, anchor arm, knee figure 4. Opposite hand, pushing that leg open and really sitting into that, oh, that butt cheek, that glute. So being that this is my dominant leg, because I'm on crutches, so this leg is doing all the work, this glute is so tight, which then tightens the right side of my back, which is already overdeveloped because I have scoliosis. So loosening this up is key to not screwing up the rest of my body. So again, just slow circles. If you want more pressure, you can take that elbow down, sitting into that hip. And then again, straighten the leg and rolling over into the hip flexor. And if anything is painful, and I mean like, oh, I can't handle it, pull back and just stay there. Don't do anything that hurts, that is painful, because you will find spots that it takes your breath away. So you want to gradually move into those areas. Good. And then you repeat on the other side. Cast up. If you are in a cast or you are injured, be sure to go easy, because you will find that if you've been in a cast for a minute, things are different. Muscles are different, alignment is different. So, yeah. We want to keep the energy moving through the fascia, especially on a site of injury. A site of injury is keeping all that motion, all that energy motion going through that area of injury. So if you are recovering from injury or surgery, or you are about to go into surgery, this is a great practice to adopt so that you can get your fascia hydrated, keep that energy flowing so that you heal rapidly. Well, thanks for watching, and I hope that helps. If you would like to see more on myofascial release and chronic pain management, hit the subscribe button or leave me a comment, and hopefully we'll see you soon. Be well.